Welcome back to Thursday's edition of City News. Are you affected by macular degeneration? With me now is Tony Bland to explain more. Welcome, Tony.
How you doing there? Good to see you again.
What is macular degeneration?
The macular degeneration is a condition that not many people are aware of. You know, a lot of people have heard of cataracts and glaucoma, but macular degeneration is something that's occurring probably as frequently in the older populations. The macula is the point of your sharpest vision at the back of your eye that you use anytime you're looking at details. So reading signs, reading details like writing on the television, and of course reading up close, and looking at details on people's faces. And you know, it's a centrally important part of your vision because it has the, you know, it's something that's used so routinely in your day-to-day life.
Okay, what are the causes of macular degeneration?
What happens is if you look, imagine you're looking into the back of your eye, you see, if you imagine you're standing up really close to someone's pupil and peering inside, you see a little red spot right in the centre of the retina where the light receptors have their highest concentration. And what happens is the causes of it are, you see little deposits building up there that affect the centre part of your vision. And you see these little deposits build up, sometimes in quite small amounts and sometimes in quite significant amounts.
Okay, does that change the look of your eye from the outside?
No, you'll look normal on the outside, and that's the interesting thing with many eye conditions. It's not something that you can look at someone and go, oh, there's something wrong with their eyes. You know, you can't readily and easily see that someone has something wrong. Okay,
so what signs should someone be looking out for?
Often in the early stages, the signs are very, very subtle, where there's maybe just slight loss of detail. So maybe they have a little bit of trouble with a really small detail like the telephone book, or when they're looking further away with smaller details like perhaps seeing writing on the television or writing on signs. The important thing though is that there are other things that can cause the same symptoms. So we always try to emphasise to people not to assume that they have macular degeneration just because they have those particular symptoms.
Okay, are there different types of macular degeneration?
Yes, there are. There's two types. There's a dry form and a wet form. In the dry form, what happens is there's these little deposits build up around the macula itself, and those areas of retina are basically tissue that is kind of lost or dead, if you like. And you imagine that you just lose little sort of gaps or holes in your vision. What happens in the wet form, though, is there's a leakage of the blood vessels underneath there, and the retina can actually swell slightly, and that can cause people's vision to get distorted in significant cases. And for example, some symptoms are they look at a fence post or a lamp post, and it can have quite a kink in it or a bend in it, and naturally that can be quite alarming.
No, absolutely. That would does it come on like automatic straight away, or will it build up? Is there a process to it?
Typically, the process occurs quite slowly, but it can occur, you know, sometimes without sort of noticeable sort of build-up. You know, the typical process can be quite gradual, so you don't necessarily notice that there's, you know, things going on until it's occurred as well. Okay.
If you feel that you may have the condition, is early detection, what should you do?
Well, basically, what we recommend is having your eyes checked. The main thing is we want to differentiate the symptoms, you know, that are caused by other conditions, such as cataracts, for example, or glaucoma or other eye conditions, or even just a lack of focus, because of course if your eyes are out of focus because you need glasses, that can also make your vision blurry. And then what we do is we have a good examination of the macula at the back of your eye and see how it's looking, make sure it's okay.
Okay, so this just a general...
Just a general check is fine, and normally every couple of years is okay, you know, unless there's particular situations like family history and so on.
Okay, and which part of the community does this normally affect?
There's sort of two things you can do about it and two things you can't, and that it gets more common as you get older, which again you can't do much about. So it's more common in your 70s and 80s, and it's more common if you have a family history too. So again, if you have a parent or a brother or sister who have the condition, then there's a higher chance that it will occur, you know, with yourself, and it's the same with most medical conditions. But it's not a given, of course.
Okay. So what should friends and family should look out for?
basically the same symptoms. So looking for anything unusual, we usually recommend again just getting a check to ensure that they're getting a good baseline of their vision. And some of the preventative things that you can do is to encourage people to give up smoking if they're smoking and to cut down on UV exposure. There's thought to be a bit of a relationship there, so using sunglasses and those, eye protection is appropriate. And yeah, just having things checked is really the best thing.
Okay, many thanks for coming in today, Tony, and explaining macular degeneration.
No worries, you're welcome, thank you.
Thank you. Have you got any hidden gems lying around the house? Find out what they're worth after the break on City News.